Esplin?
Yeah.
How are you doing today, my dear?
Oh, not good.
Not too good?
No.
All right, well, I heard from the CNA that you have been experiencing some pretty bad pain.
Oh, yeah, very bad.
Yeah? All right, well, I've got some Dilaudid for you, so that's hydromorphone. Have you ever heard of it before?
No.
No? Okay, so it's just going to help with pain. So if you're feeling pretty bad right now, I'm just going to assess your pain really quick. Okay, so probably a 10, so the most severe pain.
Yeah.
Okay, so I'm going to give you this through your IV. But first, I'm just going to kind of ask you some questions just to get an assessment on you before I give it to you, okay?
Okay.
Okay, so I'm going to give it through your IV, and I'm going to give you about 0.5 milligrams. And then, do you have asthma? Do you have history of asthma?
Not at all.
Okay. What about allergies? What are you allergic to? Are you allergic to any medications at all?
No, dear.
Okay. And then you've had any renal or liver or serious pulmonary diseases in your history, have you?
None.
Okay, perfect. So I just ask you that just because this medication, the way it lasts, if you have damage to those organs, then it could have more effect on your body, okay?
Oh my.
Okay, so before I give you this, I just have to assess your respirations really quick, okay? Just your vital signs.
Yes.
All right, so you got about 18. Now, if it were lower than 10, I wouldn't give you this medication because it can cause you to stop breathing and to slow your breathing, okay?
Okay.
Okay, so I looked and your blood pressure and your heart rate's good enough that I can give you this medication. Okay, so some side effects with this medication are constipation.
Oh my.
So with this medication, what you're going to want to do is we're going to try to get you up and walking and probably push more fluids in you and give you more fiber in your diet just because so we can move that, start moving your bowels just because this medication can kind of slow them down a bit. Some other side effects, you'll probably be a little sedated, so you'll probably kind of feel tired, a little dizzy. Make sure that you kind of move around slowly just because it can cause lower blood pressure, okay?
Okay.
Okay, and then it may make you confused. If you get really confused, you got to notify me. If you feel like you're starting to breathe slowly, then make sure that you notify the nurse or your doctor, okay?
Alrighty.
All right, so I'm going to give it to you. So this is going to be mixed in with 5 milliliters. It's going to be diluted with 5 milliliters of normal saline, and so that's just because it is kind of a strong medicine. We don't want to give it to you so concentrated. And I'm going to give it to you over quite a bit of time, probably 3 to 5 minutes, okay? And that's just because if I give it to you too fast, it'll cause that respiratory depression, all right?
Oh, yes.
Okay. So I'm just going to flush your IV really quick, and it looks good. Okay.
Is my cat safe?
Your cat's very safe. Is she at home?
Good. I hope so.
What's your cat's name?
Susan.
Susan? What kind of cat is it?
Oh, she's brown and white.
Oh, that's cute. I bet you'll be excited to see her.
Oh, yes, much so.
Good. Okay, so that's about 5 minutes. So we're going to let that work for you. Okay, so this medication, it does kind of have a potential for dependency, dependent on it. So we just want to make sure you just want this for the pain, okay?
Okay.
Okay, sounds good. And again, just make sure you change position slowly. You may not apply here, but make sure you don't take any alcohol. It looks like you're not taking any benzodiazepines or any other CNS depressants, so we should be okay with that. And then, so I'm going to ask you a couple questions. So what are the side effects that you should look for with this medication?
Constipation?
Yep. So
yes, of course.
So what other side effects should you look for?
Use some prunes.
In some prunes, exactly. We'll give you some of those if you like them.
I love prunes.
Oh, good. We'll have to give you some of those then. Have some prune juice.
Yes.
And then any other side effects that you should look out for so you can notify me?
Dependency.
Dependency, yep. So if you start feeling like you really need this drug, maybe not just for pain but for other reasons, maybe just let me know and we can try something else.
Yes.
And then also, if you start feeling really sedated and really strange and dizzy, just make sure you let me know because it could be a sign of toxicity. We don't want to give you too much, okay?
Yes.
All right. And so what should you do with this medication? Because it's causing low blood pressure, what should you do?
Have higher blood pressure.
Well, I guess that too, but we want to make sure that you're changing position slowly, okay?
Of course,
Just
of
because it could
course.
cause orthostatic hypotension or decreasing blood pressure when you move around.
Good.
All right. I'll come in and check on you in a little bit, okay?
Bye, dear.
All right. Okay.